Hello everyone, my name is Snail Desai and I will be going over the arrhythmias topic in this NAPLEX review course. You can see here some of the topics that we have already discussed or will be discussing in our cardiovascular lectures in this course. As I mentioned previously, some of these topics contain content that may overlap, where some of the medications are used in multiple disease states or scenarios that you may encounter in a case-based question on a test. So you need to understand when to use the medication for what disease state here, and also understanding the mechanisms of these medications as well that pertains to that particular disease state. So we'll look at all of these things. This is just a preview of some of the mechanisms. I'm just going to show you in these slides, so at least you have an idea as to what to look out for in terms of preparing for the NAPLEX exam. So in our when it comes to arrhythmias, they are basically abnormal heartbeats. Someone could be having a very fast heartbeat, and they it might not be a regular heartbeat. It might be irregular. So it's a irregular rhythm of those heartbeats. So you have to understand that arrhythmias are generally just those irregular rhythms. So when there's a pathway that's normally used and when the signals are being generated or how they're being traveled throughout the heart, electrical signals, and this pathway is important for the heart. It starts from the sinoatrial node, goes to the AV node, the bundle of His, the bundle of branches, the Purkinje fibers, and then the ventricles, so that the ventricle can do its work in contracting and then pumping the blood out and going to other parts of the body and all of that. So that's very important. Um, and so whenever there's an irregular heartbeat or whenever there's arrhythmias, there are certain classes of medications that are used to help prevent signals from occurring abnormally. So you can see here some of the places that the signals can get blocked so that these irregular heartbeats do not occur. In this case, we have the sodium channel blockers, the beta blockers, potassium channel blockers, calcium channel blockers. I won't go too much in detail on these mechanisms. As you can see, they're pretty much self-explaining. They block these different channels. So at least know what channels what medications block which channels. Just in case they ask you that on the test, you're going to need to know where where these medications are blocking which channels. So understand that. I will, however, talk a little bit about how the digoxin and the adenosine mechanisms work. These are some of the special mechanisms that help with the heartbeats as well. Um, so I will go over that. The beta blockers, as you know, beta blocker is going to help reduce the heartbeats. So metoprolol succinate, for example, the ones that use for heart failure, metoprolol succinate, remember the three: carvedilol, bisoprolol, and metoprolol succinate. Metoprolol succinate, you already know that it's also used for heart failure as well, specifically heart failure refractory ejection or reduced ejection fraction. So understand that, but it's also used in helping with arrhythmias. Calcium channel blockers are not used for heart failure, but there's an exception which it can be used to help with arrhythmias, particularly the non-dihydropyridine calcium channel blockers. So know that. And then you probably already know that amiodarone is a common potassium channel blocker used for arrhythmias. And some of the other ones you might have encountered is lidocaine and flecainide. Those are also important ones that help with the arrhythmias as well. So let's take a look at some of these mechanisms for digoxin and adenosine. So digoxin is an interesting mechanism. What happens is when digoxin is taken, it inhibits the sodium potassium ATPase pump. So that, normally sodium, there's 3 sodium that goes out for every for every 2 potassium that goes in. And then you have sodium calcium exchanger where 3 sodium goes in, 1 calcium goes out. So whenever digoxin is taken, it blocks the ATPase pump where the sodium is taken out. So there will be more buildup of the sodium inside the cardiac cell. And whenever there is more sodium inside, it's going to have more than enough for the cell that it doesn't need more sodium to come in through the sodium calcium exchanger. So calcium was also going to be increased inside the cardiac cell as well. So calcium, as you probably already know, calcium is important for some of the functions within the heart as well. So as you already know, calcium is also used particularly mainly for the contraction of the cardiac cell. So you need to understand that too. Um, that the importance of calcium. Mainly, you have to understand the importance of all 3 of these electrolytes here: potassium, sodium, calcium. You might see a couple. Potassium mainly, you're going to see it in many sections and other disease states and so forth. So you're going to need to know that. And calcium, you're going to see in some other disease states as well. So understanding the significance behind these 2 electrolytes, as well as sodium, is very crucial for the exam. So, and it will help you in answering some of the questions as well, because sodium, calcium, potassium, somehow they play a role not only for arrhythmias, they play a role in helping with other function bodies like the thyroid, or you might see some of these electrolytes being used for like blood pressure, and all that stuff. So you're going to need to know the significance behind all 3 of these electrolytes so you can understand how they play a role in other disease states as well, for the exam. So what happens is whenever this digoxin binds or inhibits the sodium potassium ATPase pump, it's going to decrease the ability for sodium to come in from the sodium calcium exchanger. So less of that is going to occur. So there's going to be more calcium inside the cardiac cell. So for that contraction to occur. So it's going to be a decrease in gradient for sodium to enter the cell and so forth. And then you have the next thing here, which is adenosine mechanism. This one has multiple steps in it. Whenever adenosine binds to the A1 receptor within the AV node, it's going to activate the GI protein and then inhibit the adenylate cyclase enzyme, which is going to decrease the CAMP levels and therefore decrease the calcium amount that goes inside the cell and increase the potassium efflux, or potassium goes out of the cell. So calcium is going to slow the depolarization in the AV nodal cells. And so with the slow conduction, there won't be, it will just stop the AV nodal firing, so it will become more, it will slow the conduction essentially in the electrical signals from occurring. So it will kind of put a stop in that signaling process. And that pretty much concludes this presentation. Again, I will have additional videos, additional presentations. You guys will have some practice questions that go along with these slides as well, and additional materials as well. So just giving you a brief overview of how certain medications work. As I mentioned, some of the mechanisms are important, especially since it's within that domain of the NABP blueprint. So I'm just pointing out a few things here. Like I said previously, definitely use these as a guide while you're studying your materials. These are quick guides, and I think you guys should do well if you guys pay attention to these presentations as well as reading your materials. Seeing it visually really helps too, so that's why I put all these visual mechanisms for you to kind of understand how these medications are working and how it may contribute to side effects of other medications, possibly through its mechanism, or how it will help that patient in when they're having that disease state. So study well, study hard, study smart. Definitely do not stress out, just take it easy, review the materials, and, prepare for it well, and good luck. I hope this presentation was somewhat helpful to you all so that you guys can prepare well for your exam. And so I wish you all good luck and have a great day.